Hi, my name is Shelley Franco, and I will be presenting my project on workplace violence prevention in the emergency department at Trios Hospital. So first I'd like to just have you note the mission and vision at Trios Hospital. So it points out quality and compassionate care to the patients that we serve. The organizational assessment for this project includes Trios is a community hospital with a rural and urban patient population. The ED has 27 beds and is staffed, of course, 24 hours a day. So while the mission and vision of Trios point out that they expect compassionate and quality care, it doesn't necessarily define what that care is. So the mission and vision could be improved. The Trios Hospital is a physician teaching hospital. So there is constant talk of evidence-based practice. That is definitely positive on the part of the organization. Leadership is committed to the use of EVP. There are quality improvement in projects at the hospital. However, there is no formal research being done, generation of EVP at the hospital. Trios also doesn't do very well at providing EVP resources such as a critical mass of EVP nurses or mentors, and there are no library facilities at the hospital. However, overall, Trios' organizational culture is conducive to integration of clinical inquiry. So workplace violence disproportionately affects healthcare workers. Of assaults reported, 70 to 74% of them occur in the healthcare setting. Assaults are also more severe in the healthcare setting, requiring 10 to 11% of healthcare workers to take time off work as compared to 3% of the general population. 27 of the 100 fatalities reported in 2003 occurred in the healthcare setting. So among the healthcare workers, ED nurses are at a greater risk of workplace violence. They see risky patients, that includes violent patients, drug and alcohol abusers, gang members, patients in pain, patients who have received a devastating prognosis, patients in unfamiliar surroundings, patients who have received mind-altering drugs, and patients who are experiencing disease progression. EDs are open 24 hours a day, easily accessible to the general public, also making them more vulnerable. ED nurses underreport workplace violence. 82% of ED nurses report having been physically assaulted by a patient, and 100% report being verbally abused. So workplace violence has financial implications for the organization, and that includes nurses must take time off work to recover. They experience anxiety. There's increased turnover rates, decreased job satisfaction, and patients who are violent to their nurses report a decrease in quality care. The project stakeholders include the nursing staff, the security officers, physicians, supporting staff, ED management, ED patients and family, and Trios organization. The PCOT question for this project is, in ED nurses who experience workplace violence, how does workplace violence prevention strategies compared to no violence prevention strategies affect ED nurses' emotional, psychological, physical comfort, as well as increased quality patient care and financial gains for the organization? The project objectives include finding and implementing recommendations for dealing with workplace violence, implementation of a zero-tolerance workplace violence prevention policy, and that will be done by the third week of the project. Educational awareness and flyers will be posted by the third week of the project, and workplace violence awareness training workshops will be held at 1 and 6 months from project initiation. So the literature support indicates increased levels of anxiety in nurses who experience workplace violence. Nurses feel workplace violence is unavoidable. Barriers exist to reporting that violence. Um, security measures need to be implemented, and leadership need to be on board with workplace violence prevention. Gates, Gillespie, and Suckup notably found that 7 days after a traumatic event, 17% of nurses had scores high enough on their questionnaires for a diagnosis of PTSD. So this is serious business. Workplace violence can be reduced by not being alone, being prepared, being upfront with patient expectations, supportive leadership. Nurses underreport workplace violence, and many nurses feel it's part of their job again. So once again, workplace violence occurs at a high rate, especially verbal, and then 66% of respondents in this study also reported physical abuse. Again, another study showing that verbal and physical abuse is occurs at a high rate. So the solution to workplace violence is prevention. It's the most desirable solution and also the safest. So an effective workplace violence prevention plan includes several different attributes. This project will include leadership commitment and involvement, security officer presence in the ED, workshops, violence prevention training, implementation of an EBP mentor, and ongoing quality improvement sustaining behaviors. So our outcomes for the solution are going to be to increase staff awareness on workplace violence and reporting mechanisms, giving staff the knowledge and tools to prevent, empowering staff to report and respond to workplace violence, decrease the workplace violence at Trios, and then decrease costs associated with workplace violence. And in the end, the ED will be safer. So the change model chosen for this is the Advanced Research and Clinical Practice through Close Collaboration model. It was chosen because this model has an environmental assessment, establishment of an EBP mentor, and initiation with ongoing assessment of change behaviors. And this model is illustrated in this screen. So implementation. This plan includes heavy leadership involvement, educational modalities, assessment tools, and implementation of new staff positions and policies. So we're going to have a new EBP mentor on staff full-time, and then a security officer stationed in the emergency department around the clock. Educational modalities include signs, emails, workshops, definitions, posters, those kinds of things. So the tools for evaluating this project will be a 16-item Likert scale that assesses beliefs, and a workplace violence staff assessment survey. The staff and resources are easily accessible to this project and implementers. So lots of resources are available on the Emergency Nurses Association website and also OSHA. So implementation timeline, we'll introduce the project and give initial surveys at week 1. We will identify the EBP mentor, and the security officer and EBP mentor will begin intensive training. Week 3, zero tolerance policy, in effect educational workshop will be held, and the security officer will continue orienting to the ED. 3 months out of follow-up surveys, changes made to the educational modalities based on those surveys. And then at month 6, a second educational workshop will be held with those changes. At month 9, the third round of surveys will be given, and this round will tell us whether the project is successful. Based on those survey results, we may change our educational approach a bit and implement sustaining activities at month 12. So this project's success will be evaluated based on the achievement of project outcomes. So both surveys will allow project facilitators to measure whether the project activities and change behaviors have affected a successful implementation of workplace violence prevention plan. So the survey measures staff knowledge and awareness on workplace violence prevention, whether staff have the tools for workplace violence prevention, and whether staff feel empowered to report and respond to workplace violence, if there is a decrease in workplace violence, and if the ED is safer for staff, patients, and family and visitors, which are, again, relate back to the project objectives and will ultimately show the success of this project. Thank you for your attention. Now we'll follow the resources. I'm sorry, references.